Hello, everyone, and welcome to the session of Informing Practice After COVID, Lessons from the Pathways Clearinghouse. My name is Frances Dixon, and I'm a TANF Program Specialist in Region 5, Chicago. Thank you for choosing this session and participating, and I'm sure you all will hear and enjoy and value the information today. In addition to the enormous challenges COVID-19 posed on TANF agencies' service delivery, it also led to a sharp increase in unemployment. To help TANF agencies better serve clients during such unprecedented times, the Pathways to Work Evidence Clearinghouse undertook 2 projects to learn from past periods of economic difficulty and to identify innovations spurred by COVID-19. To tell you more about the project and introduce the presenters, I will turn the session over to Diana McCallum, the Senior Director of Research and Development at Mathematica. Diane, it's all yours.
Thank you, Frances. Get everything up. Hi, everyone. Good afternoon, and welcome to this session, Informing Practice After COVID, Lessons from the Pathways Clearinghouse. My name is Diana McCollum, and I'm the Project Director for the Pathways to Work Evidence Clearinghouse. We're really excited for this session today, and I'm excited to be moderating and introducing you all to some interesting findings based on data from the Pathways Clearinghouse. The research we're going to talk about represents just 2 of several syntheses and summary products that the Pathways Clearinghouse team is currently conducting to distill the findings from interventions and studies that have been reviewed by the Pathways Clearinghouse. The goal of these products is to help administrators, policymakers, and other key Pathways Clearinghouse stakeholders to use the research in the Pathways Clearinghouse to help make evidence-based decisions. So we'll start off by introducing our panel, and then I'm going to turn it over to Dana Roth. Because the findings that are summarized today are going to draw on the research identified, reviewed, and cataloged by the Pathways Clearinghouse, Dana is going to start by providing a brief summary of the Pathways Clearinghouse and our goals and processes. Then she's going to summarize the findings of the synthesis of interventions implemented during recessions and recoveries. And next, I'll turn it over to Katie Edens, and she's going to discuss a recent Pathways Clearinghouse brief that highlights how during COVID-19, organizations began to deliver interventions remotely and conducted internal processes virtually and plan to continue new service delivery strategies post-pandemic. So we'll conclude our session with a commentary from Tyrese Thomas, who's going to provide commentary on these products to help other organizations really understand what might work best for clients. All right. So I'll just do some brief introductions for the members of our panel. Dana Roth is a senior researcher at Mathematica and principal investigator for the Pathways Clearinghouse. She has more than a decade's worth of experience evaluating policies and programs for working families with low incomes. She also has worked on several other systematic review efforts like the Pathways Clearinghouse, including DOL's Clearinghouse for Labor and Evaluation Research, known as CLEAR, and the Institute of Education Sciences What Works Clearinghouse. Next, we have Katie Edens, who's a researcher at Mathematica, and she led the development of the brief that she'll talk about, describing how organizations that were serving job seekers responded during the COVID-19 pandemic. Katie has more than 10 years of experience working in and studying programs that support families with low incomes. Since joining Mathematica in 2016, Katie's work has focused on formative, qualitative, and implementation research in domestic policy areas, including income support, employment and training, and healthy relationship education. And prior to joining Mathematica, she provided direct service assistance and case management in New York City. And in addition, we have Tyrese Thomas, who's the Assistant Director of Employment Services at the Department of Transitional Assistance in Massachusetts. Tyrese is a state level administrator who oversees the TANF program and works closely with several practitioners within her area. All right, so now I'll turn the presentation over to Dana Roth to provide a brief overview of the Pathways Clearinghouse and provide a more extended discussion of the paper that focuses on what works to improve outcomes during recessions and recoveries for individuals with low income. Dana?
Thanks, Diana. The Pathways to Work Clearinghouse began through a congressional mandate. Congress directed HHS to create a database of projects, which we refer to as interventions, that have used a proven or promising approach to move welfare recipients into work. With this in mind, the Pathways Clearinghouse has 4 key goals. The first is to conduct a systematic review of the impact evaluation literature on employment and training focused interventions for individuals who have low incomes. The review needs to be transparent and comprehensive. We house this review on the Pathways Clearinghouse website, which Diana is showing on the slide here. The next step is to rate those interventions according to pre-specified criteria to determine if the programs demonstrate evidence of effectiveness in improving outcomes. Interventions are rated as well supported, supported, not supported, mixed support, insufficient evidence to assess support, and no evidence to assess support. Interventions receive effectiveness ratings within multiple outcome domains, and specifically, we're interested in impacts on employment and earnings, reductions in public benefit receipt, and increases in education and training. You can find the results of this review process through the website's Find Interventions That Work portal. The third goal of the Pathways Clearinghouse is to present the information that we collect on a high quality, user friendly website, which again we're showing here, that presents the review's findings. In addition to information about interventions, that site has other resources like videos and products that synthesize what we're learning from the evidence. We'll talk about one of those syntheses today as well as an additional product. Once available, these products can be found under Other Pathways resources. Last but not least, an active goal of the Pathways Clearinghouse is to promote the website and ensure that key stakeholders, including everyone listening today, are aware of the website and its usefulness. So, obtaining stakeholder input to inform each of our goals is an important guiding principle for the Pathways Clearinghouse. We want Pathways to be informed by the wisdom, insight, and guidance of end users. We've held various expert stakeholder meetings to obtain input on the scope of the review and its content and the website's design. We welcome your feedback as well. Next slide, please. The Pathways Clearinghouse assesses the quality of evidence from both individual studies and across study findings. Eligible studies include research on the impacts of employment and training programs on individuals with low incomes in the United States and Canada. For eligible studies, we capture information on intervention characteristics and study characteristics. A central goal of the study review process is to assess the strength of a study's design, that is, the risk of bias, and assign it the most appropriate study rating. The Pathways Clearinghouse currently reviews research using 2 eligible designs: randomized controlled trials, or RCTs, and comparison group quasi-experimental designs, or QEDs. We rate studies as high, moderate, or low, but we only include findings from high and moderate rated studies in most of our analyses because those are the studies that we can have at least some confidence that our findings are reflecting the impacts of the interventions being studied. Because the Pathways Clearinghouse seeks to move beyond reviewing individual studies and toward creating a repository of interventions with rigorous evidence of effectiveness, we then group studies into interventions if the same services are offered in both cases. And finally, we aggregate information from across studies to determine an intervention's effectiveness rating for several sets of outcomes. So, as I mentioned before, to help distill actionable findings from the research reviewed by the Pathways Clearinghouse, the Clearinghouse team synthesizes information across findings, studies, and interventions, and shares those syntheses in briefs and reports. Today, I'm going to talk about the results of a synthesis focused on understanding the types of interventions most likely to help individuals with low incomes improve their earnings and economic self-sufficiency during different economic conditions. This analysis can help inform practitioners and policymakers about the interventions most likely to help individuals succeed in different economic conditions and help them both make short-term pivots and plan for the longer term. Next slide. For this synthesis, we included 1,438 findings on the effects of employment and training interventions on earnings, employment, public benefit receipt, and education and training. Although the Pathways Clearinghouse catalogs both short-term and long-term findings, we omitted findings related to effects on short-term public assistance for this analysis because during recessions in particular, we might not want to reduce public assistance receipt, even if reducing public assistance receipt is a goal of many programs and policies overall. All of these findings focus on comparing an intervention group that received an intervention to a comparison group that did not. Therefore, the findings reflect the effects of the intervention relative to services typically available and provided. So these findings that we've kind of put together came from 188 studies on 144 different interventions. In total, the Pathways Clearinghouse actually includes more studies and interventions than this, a total of 295 studies on 221 interventions and growing. The studies for this synthesis are limited to those with a high or moderate evidence rating, meaning the Pathways Clearinghouse is relatively confident that the estimated impacts reflect the true effects of the interventions examined rather than some other factor. We group studies for this analysis based on the economic conditions occurring during study enrollment. We use an employment-centered measure of economic conditions. We consider it a recession when the unemployment rate is rising and a recovery when the unemployment rate is falling. Stable economic periods are those in which there's no strong upward or downward trend in the unemployment rate. There are many reasons why economic context might matter for intervention effectiveness. Importantly, the economic conditions faced by the intervention group and the comparison group will be the same in all of the studies that we're analyzing. So these factors are all about how the effects of interventions might differ in different economic conditions, rather than the direct effects of the economy on how easy it is or hard it is to find a job. Past research suggests a few reasons why intervention effects might be different during recessions or recoveries. In particular, during different economic conditions, employers might be more or less selective, costs of training might be lower or higher, more or different people might be competing for jobs, and more or different people might be seeking services or receiving services. All these factors could lead to differences in intervention effectiveness across different economic conditions. So if we go to the next slide, we'd like to start kind of thinking about the issue of how intervention effectiveness might vary across different economic conditions with this poll. So if you go to menti.com and click and use the code 9059527, which is up at the top of your screen, or if you go to the link that Katie has provided in our room chat, you can access this Menti poll. And then you can tell us, what would you expect? When would you expect program impacts to be highest? Would you expect impacts to be highest during recessions, recoveries, stable economic conditions, or economic conditions won't matter much and there shouldn't be much variation? So I'll give a moment for folks to answer that poll. All right, so interesting. As people are starting to answer, it's mostly focused on people thinking that recessions and recoveries are going to be when we see program impacts that are the highest, which I think is interesting. It's showing that there's differences in people's beliefs here. And I think hopefully we'll be able to kind of dig into this a little bit more. If we go to the next poll, this is kind of the flip side of things. Oh, this is kind of the flip side of things. When would you expect program impacts to be the lowest? I'll again give a couple seconds for people to answer. All right, we've gotten a few votes for stable economic conditions and more coming in. This does seem to be where people think program impacts will be the lowest. Any other? Just waiting to see if anyone else wants to vote there. And we also have a vote for recessions and one for economic conditions won't matter. Interesting. So I think there's a little bit of research actually showing the possibility of all of these being correct. And you'll see in a moment how what really matters perhaps is what we're thinking about in terms of a program. So if we go on to the next slide, the good news is that regardless of what you think is most effective, least effective, or whatever, there are many interventions that have been shown to improve outcomes in each type of economic condition. So the Pathways Clearinghouse identified 30 interventions implemented during recessions. Of these, 8, or just over 1/4, improved participant outcomes on average. For recoveries, the Pathways Clearinghouse identified 95 interventions, 22 of which, again about 1/4, improved participant average outcomes. And then finally, we have 33 interventions implemented during stable economic periods. 6 of these, or about 18%, improved participant average outcomes. So in addition, we see that average impacts of interventions are positive during each of the different economic conditions. Overall, interventions had an impact equivalent to increasing annual earnings by about $1,000. Throughout, we'll present estimates for today's discussion in terms of equivalent increases in annual earnings, but we're actually calculating averages using impacts on employment, earnings, public benefit receipt, and education and training outcomes, not just annual earnings. We've just transformed these into annual earnings terms to make them a little bit more interpretable. So we do see, consistent with what a lot of you all suggested, is that impacts are somewhat larger in recoveries. The average intervention implemented during these periods had an effect equivalent to raising annual earnings by about around $1,300. And we also see impacts being smallest during stable economic conditions. But as I'm going to show you in a moment, it's really more complex than that because these patterns are going to vary for different types of programs and different types of interventions. Next slide. So to dig deeper into what improves outcomes among people with low incomes during different economic periods, we also grouped interventions based on their primary service, or the service that most strongly distinguishes the intervention of interest. This allows us to better understand what types of services might be most helpful under different economic conditions. Intervention categories include case management or other supports, meaning interventions focusing on assessing clients' needs, linking clients to other available services, and providing other supports to overcome barriers like substance abuse counseling or classes to promote financial literacy. Education and training interventions, employment retention services, which focus on helping employed people maintain their jobs and progress in their careers. Employment services to help people prepare for, find, apply to, and obtain jobs. Incentives and sanctions, which focus on providing or taking away cash or non-cash benefits, for example, providing additional public assistance benefits or reductions in funding for childcare. And finally, work and work-based learning interventions that focus on providing clients with work and on-the-job learning opportunities. So what we find looking during recessions is that the evidence supports interventions using 3 primary services. Interventions focused on case management or other supports improve outcomes by the most during recessions, $1,650 in annual earnings terms on average. Interventions focused on providing employment services to help people find, apply to, and obtain jobs also improved outcomes during recessions, as did interventions that focused on providing individuals with jobs, work experience, or on the job learning experiences, the work and work based learning category. The evidence suggests that education and training interventions to help people maintain the jobs that they already have, and interventions that provided incentives and sanctions like reemployment bonuses did not seem to improve average outcomes in recessions. We can look at this a little bit differently. Um, Instead of looking at what improves outcomes during recessions, we can look at how intervention effectiveness differs across economic conditions. In other words, we can ask, are some types of interventions more or less effective depending on economic conditions? So here we show the difference in the average effects of the interventions by type, comparing recessions to stable periods. Positive numbers or bars on the right-hand side and to the right direction indicate that an intervention is more effective during recessions. Negative bars or bars in the left direction indicate that intervention is less effective during recessions. So two things are going to jump out from comparing recessions to stable periods. First, it looks like interventions focused on case management or other supports have larger effects during recessions than stable economic periods. Conversely, education and training interventions actually have much smaller effects during recessions compared to other periods. Other differences for other types of interventions tend to be smaller and not statistically significant. So the key takeaways here are that, overall, what we see is that interventions implemented during recessions that primarily focused on case management or other supports, employment services, and work-based learning programs do improve outcomes. Likewise, considering patterns in average intervention effects over time, practitioners and policymakers should consider placing more emphasis on case management and other support programs and less emphasis on education and training when unemployment is increasing. So we looked at recessions, we then looked at recoveries. Remember that we defined a recovery as a period in which the unemployment rate is decreasing. The unemployment rate might still be high in these periods, but conditions do appear to be improving. 5 of the 6 types of interventions we considered improved outcomes on average when implemented during recoveries. The largest effects are seen for education and training and work-based learning interventions. Both of these interventions improved average outcomes in a manner equivalent to boosting earnings by $1,500 or more each year. The effects for employment services interventions were also quite sizable. The only type of intervention without a statistically significant average effect during recoveries was employment retention services, which again aim to help employed workers keep their jobs. So we also compared interventions effects during recoveries versus stable economic conditions. Here, there was only one statistically significant difference. Interventions focused on case management or other supports had much larger effects during recoveries than stable periods. Thus, altogether, many types of interventions appear to improve average outcomes during recoveries, with the strongest improvements seen in interventions aiming to build human capital, those focused on education, training, work experience, and work based learning. There's less evidence supporting interventions focused on employment retention services. Therefore, practitioners and policymakers should consider targeting resources towards interventions other than those focused on employment retention services when the unemployment rate is falling. Okay. So, taking a step back here, um, I'd like to open up the floor to kind of some answers from you all on what services have your clients benefited most from during COVID-19. So again, if you joined us late, you can participate in this poll by clicking the link that we've provided in the chat, or by going to menti.com and using the code 9059527. So I'll give a moment for people to weigh in there. What services have your clients really benefited from most during COVID-19 and the subsequent period? Okay. So I'm seeing case management, which is really consistent with the pattern we saw both in recessions and recoveries, with case management being relatively effective during those periods. Anything provided remotely, of course, we understand that that's a big issue, and Katie will actually talk a little bit more about what we've seen from remote service delivery during COVID-19 and what we can learn from that. We can't really say much on remote delivery with this particular analysis simply because this analysis draws on past literature. It draws on research published from 1990 to 2020 or 2019, I'm sorry, and we just don't know much about remote services, and we're learning more and more every day about that. I see additional funds, individualized support, creative ways to further assist families, all great things. Options to do things virtually, again, related to the anything provided remotely. More on additional funds and ongoing case management and support services and remote services, kind of echoing all of that. So this is really good to keep in mind during this particular downturn. I'll give it one more second to see if there's anyone else who wants to weigh in with anything. Okay. All right. So going on, and taking a step back, and with the good thoughts that you guys have provided in that poll in mind, it's also important to note patterns across economic conditions. So, for instance, when we were looking at COVID-19, we were looking at, definitely a recession, and then possibly some, and then certainly now a recovery period that we're seeing, and it's really important to just think about multiple economic conditions during planning and thinking about your different interventions that might be offered. This is especially important when we're not quite sure what economic conditions will be like during implementation. So for example, we might be in a stable economic period. Unemployment rate has been flat for a while, but we're worried about a recession occurring. Or like recently, we weren't quite sure if unemployment would actually keep rising due to the COVID-19 pandemic or start to fall, and when it would start to fall. So what we're showing here is a stereotypical business cycle. This slide shows a stereotypical business cycle that is characterized by a sharp initial increase in unemployment, longer period during which the unemployment rate declines, and relatively stable period after the decline. If you look at the unemployment rate in the Great Recession, it looks a lot like this. So for each phase, the recession, recovery, and stable period, we've listed the types of interventions shown to improve outcomes on average. And interventions with the largest effects are listed kind of highest in that list. So what you see here is that there are different types of interventions are most effective during different periods. So for example, case management interventions have the largest effects during recessions, kind of consistent with what you all said during the poll, but education and training interventions have the largest effects during other periods. There's a lot of differences across the list, and only one type of intervention is effective across all three phases, which is employment services. They're not the most effective during any phase, but they are effective during each individual phase. We can also think about, in addition to what's going on in current economic conditions, we can think about looking across different economic conditions by examining average effects, including interventions implemented at any time. Next slide, please. Thanks. This graph here shows the average effects of each type of intervention looking across all economic conditions. The largest effects that we see overall are for education and training and work-based learning interventions. We also see that case management or other support interventions have the smallest and statistically insignificant effects when we look across the entire, all of our interventions across all types of economic conditions. So this is particularly notable given that the case management or other support interventions appeared to be very effective during recessions and improved outcomes to some extent during recoveries. So just because something works sometimes doesn't mean that it's necessarily going to work on average. And that's exactly what we see for case management. So thinking about this, Overall, the findings here can be used if you want to do long-term planning on intervention implementation, but they also highlight trade-offs in the choice of which interventions to implement. In particular, work and work-based learning and education and training interventions have the largest average effects across conditions. So those might be, very tempting to implement. But neither of those intervention types is shown to improve average outcomes in all different economic conditions. There's at least one condition out of recessions, recoveries, and stable periods during which those interventions don't show evidence of effectiveness. On the flip side, employment services improve outcomes in recessions, recoveries, and stable periods, but average effects of these interventions are somewhat smaller overall than the average effects of other types of interventions. Altogether, this analysis shows that intervention effectiveness can vary in important ways based on economic conditions. Some types of interventions appear to be successful only in certain circumstances, while others show more generally positive effects. But it's important to note that in each type of economic condition, some types of interventions have shown to be successful. So, regardless of the economic context, there are programs that could help. It's also important to note a couple caveats with these conclusions. Although we show different patterns by economic conditions, it's possible that differences are driven by differences in the interventions implemented at different times, the client seeking services at different times, implementation, or context. For example, if individuals who are driven to succeed are more likely to seek certain services during recoveries, it could lead to higher intervention impacts of those services during recoveries. This could occur even if there are no differences in interventions or anything along those lines. It could just be the types of people that are getting specific types of services during specific economic conditions. Finally, implementers should keep in mind that the economic conditions in which they operate might be different than economic conditions for the country as a whole. So we classified economic conditions based on the national unemployment rate. This might not be a good measure of local conditions. It might not be a good measure of the conditions for individuals with low income specifically, or conditions for specific populations a program focuses on. So to learn more, we'll be posting a full report on this analysis in the coming months to the Pathways Clearinghouse website. Keep a lookout for that report or subscribe to the Pathways Clearinghouse mailing list for updates. All right, so now I'm going to turn it over to our second presentation. Katie Edens will provide an overview of a brief that she led, which focuses on lessons learned by programs that moved to remote service delivery during the COVID-19 pandemic. Katie?
Thanks, Dana. Good afternoon, everyone. As Dana said, I'm going to tell you about this brief about remote service delivery, a little bit about the motivation and where you can find this information on the website and discuss some of the findings. Thanks. Yeah. So as you heard at the beginning of Dana's discussion, the Pathways Clearinghouse examines studies, groups those into interventions, aggregating information across studies to determine an intervention's effectiveness rating for different groups of outcomes. So we do this to provide leaders and administrators like you with a sense of the interventions that have supported outcomes, meaning we have some evidence that the intervention improves earnings, employment, or education and training, and or reduces public benefit receipt. But in response to the pandemic, we wanted to provide users with more information about interventions that had favorable outcomes and search their websites to see if services were being offered remotely. And I'll lead you through some of that information. So we can go to the next slide. So this shows the Pathways homepage, and I want to draw your attention to a few areas. So in the left corner of the screen, you'll see a video that highlights sort of key features of the website and changes fairly regularly. Then in the middle, you have, if you haven't already, you can sign up for our newsletter and get updates about other events that we're hosting. And then on the right, you'll see the ongoing count of the studies and interventions that we have reviewed to date. Next slide. So if along the kind of top ribbon of the website, If you click on other Pathways resources, you'll find a lot of other resources in addition to the parts Dana mentioned about where you can find information about the specific interventions and studies. You'll be able to see webinars, the sort of protocol that governs the study review process, links to other important websites. And then in the drop down, if you click on publications and multimedia, you can access this brief that I'm going to talk about today. You'll see at the top. Next slide. So now I will tell you about the brief and what we found. So when the pandemic began, we were really just releasing the Pathways Clearinghouse to the public. So we wanted to provide people with some more up-to-date information about those interventions that had favorable outcomes to meet these really urgent and pressing needs. So we searched the websites of those interventions to see if services were being offered remotely. At that time, information on intervention websites was often incomplete or not very detailed since organizations were really quickly adjusting their services and conditions were changing. So to provide some more information, get some more detail, and be able to talk about some lessons learned about how organizations were adapting, we spoke to staff from 3 organizations that were delivering interventions that had supported evidence before they were delivered remotely. We talked to staff about how they were being adapted. So in the brief, we addressed 3 questions. What were common challenges that made it difficult for participants to engage in services remotely? How did these 3 organizations change their service delivery in response to the pandemic? And what might service delivery look like after the pandemic? Next slide. So we have another poll that asks if you all have had experience delivering remote services. And you can go to Menti and enter the code at the top of the screen or use the link in the chat. Thanks, Dana, for putting that in again. And so the options are, yes, we have delivered remote services and we continue to deliver services remotely. Yes, and we've returned to in-person. Yes, and we're doing hybrid remote and in-person. Or no, we did not do remote services. We'll give people a chance to answer. Okay, that's a pretty even split. So most have yes and return to in-person services. Now evenly split with delivering hybrid, remote, and in-person, which makes a lot of sense. Hybrid's edging it out. And then some have continued to deliver entirely remotely. Okay, yeah, so mostly hybrid. That makes sense. That's good context. All right, I think we can go to the next slide. Okay, so I'm going to tell you a little bit about the interventions that we spoke to. So to answer our questions, as I mentioned, we selected 3 interventions that had supported findings before they were delivered remotely, that were offering somewhat similar services. So in this case, we looked at interventions offering work readiness activities, education and training services, or both. And they had some indication on their website that they were offering things remotely, and then we confirmed that via email. And then the interventions and organizations were willing to allow their staff time to speak with our team. So we spoke to an integrated basic education and skills training, or IBEST, site in Des Moines, Washington, which provides integrated occupational training and adult basic education classes, and then also individual academic advising to students with low basic skills. We also spoke to Project Quest, quality employment through skills training in San Antonio, Texas, which provides life skills training sessions and academic and career counseling, while participants with low income receive occupational training from partners. And then finally, we spoke to a Wisconsin Regional Training Partnerships, or WRTP, site in Milwaukee, Wisconsin. And WRTP provides occupational and soft skills training and small group tutoring in occupational skills. So we did 1-hour interviews with a total of 7 staff from these organizations, 2 to 3 interviews per intervention. And we focus on the remote delivery of these work readiness and education training services that they offered directly through their staff and not through partners. And for those with multiple sites, we spoke to people from one site recommended by leaders as sort of representative of the intervention's response to the pandemic. Okay, great. So staff across the three organizations really described similar challenges facing participants during the pandemic. Those included caregiving responsibilities, making it difficult for people to participate remotely in services, accessing the internet or computers at school or the program locations had been common before, but was not possible during the pandemic. So participants had to purchase internet service or computers or take classes on their cell phones as potentially the only point of internet access, which was quite challenging. Participants often had to share technology, including those computers or internet bandwidth, among multiple household members at the same time. And just learning remotely was challenging for people who had never participated or in that way before and maybe were lacking some computer skills to do so. Next slide. So now we'll talk about how services changed. We have 5 key findings. So all 3 organizations moved from doing face-to-face services to using free video conferencing platforms like we're on now, and Zoom in particular as a free option. Some also use like virtual learning management platforms like Canvas and messaging services like GroupMe. So staff moved from really just offering one delivery option, which was face to face, to having these sort of multiple modalities that people could use to continue participating. This often meant staff time was spent a lot more on like planning and preparing content and materials than they had been when services were only provided in person. So these new modalities included pre-recording sessions, so participants could view content on their own schedules when they had time, which again required a lot of upfront investment and time to make those, but they're now available and organizations can continue using that content. Also offering synchronous video conference sessions like this for discussion-based topics, allowing staff to interact with participants. And for those, a lot of organizations had been using paper materials or just in-person discussion and sort of had to create PowerPoints and content potentially for the first time. And then also some, continued to provide in-person training when it was really necessary for some of those occupational skill courses, but they did so with social distancing and other safety precautions. And then creating new publicly available content. So instead of just content for people who are already participants or potential participants, some organizations created public content to reach additional audiences that they hadn't been able to reach before. Next slide, please. So before the pandemic, or some of these organizations had pretty strict attendance and assignment policies designed to hold participants accountable. But to accommodate new needs, these organizations really changed these policies to be more flexible than they were pre-pandemic, made other changes to make it easier, and just in general talked about the importance of having empathy and being flexible with the challenges that participants faced at home. So some of the modified policies included lenient late policies to accommodate participants with connectivity issues or sharing technology and caregiving responsibilities, all those things I mentioned earlier. Also flexible due dates on assignments to give people more time as they were dealing with all those challenges. Shorter session times to acknowledge the difficulty of sitting at a computer for long hours and the need to share technology with others. And then offering multiple synchronous sessions so that participants could select the time that worked best for them and their schedule for those group sort of live synchronous discussions. Next slide. So technology. So before the pandemic, most participants in these organizations accessed computers and internet connection at the organizations or schools they attended. So to meet these new challenges of accessing technology at home, organizations or their partners provided some supports, including starting or expanding laptop and hotspot loaner programs to support internet access. One organization that had already been upgrading their technology provided their staff's old laptops to participants, just a way to repurpose the resources. And then others provided technology support and more informal sort of troubleshooting, one-on-one meetings with participants, helping people become familiar with these platforms and using all these new different modalities. Next Next slide, please. And our last, fourth one is before the pandemic, staff really met frequently with participants informally, before or after sessions, you have a check-in, you answer questions. But once services moved online, that wasn't really possible in the way that it had been before. So both staff and participants had to adjust. So that included more participants requesting individual meetings, which allowed staff to sort of check in on concerns that they were having. And then also staff required more check-ins that focused on both session content and kind of progress through an intervention, but also just in general, how people were doing at home and making sure they had the supports they needed. And then also staff used more text messaging and kind of other ways to get in touch with people. As particularly as a lot of participants were using cell phones to leverage service, that was a way to get in touch with people. Okay, now our last one is that before the pandemic, some organizations, like I mentioned, had really used a lot of hard copy paperwork and had to transition a lot of their files and infrastructure online. So some organizations had already sort of been making technological investments in information sharing and were able to more easily transition to remote service delivery than others. That infrastructure included, ensuring staff had access to all the software and platforms they were using, and that they had the capacity to support large numbers of users. And then administratively, staff spent a lot more time sort of documenting their work and downloading transcripts and taking notes and taking attendance than they might have done in person, which staff found all sort of challenging at first, but supports from their coworkers and their organizations were helpful. And those supports included practicing with other staff before synchronous sessions, getting familiar with new technology and comfortable delivering services remotely, just kind of a different feel. Having virtual staff meetings and sharing successes and challenges and learning from one another. Just being able to continuously try new things and adjusting if a platform or practice wasn't working for them. So staff talked about struggling to read people's body language over video conferencing and then trying new ways to engage, like using polls and chats and icebreakers and just different ways than they had engaged with people in person. And then finally, with their coworkers, motivating and supporting each other. We heard people talking about giving mental health seminars, doing more meetings, having regular meetings, virtual social gatherings, just to help address staff fatigue and burnout from all these changes, and doing back-to-back virtual sessions in a way they hadn't done before. All right, next slide. So lastly, staff shared their thoughts with us about what service delivery might look like after the pandemic, which feels a little bit strange to say since we're still in a virtual situation. But they shared that, reflecting on their lessons learned, delivering remote services helped them consider how to transition back and sort of whether and how to supplement their in-person services with these remote components that they've become adept at delivering. And a lot of them talked about planning to use the materials and content that they created during the pandemic, those asynchronous sessions and online resources, and how those might make it easier for job seekers to access their services going forward. But sort of strongly noted that participant access to computers and internet connection remains a challenge for those that want to continue with remote services. Okay, so before I close, I'll just remind you can access this brief on the Pathways website by clicking on other Pathways resources and publications and multimedia, and you can find some more information there. And now I will turn it back over to Diana.
Great. Well, thanks, Katie, and thanks, Dana. So now we'd like to allow some time for commentary from Tyrese Thomas. So as I mentioned before, Tyrese is the Assistant Director for Employment and Training in the Massachusetts Department of Transitional Assistance. Tyrese, I thought it would be helpful if you could start out by providing just an overview of your role, and if you can reflect a little bit for the audience on why you think these are really important topics for TANF directors and their teams. So really reflecting on the recession and recovery paper and the broader findings there, and even thinking about how we continue to adapt services in hybrid contexts and still for some remote contexts only. But yeah, I'd like to turn it to you to get us started there.
All right. So I'm Tyrese Thomas. I'm the Assistant Director for Employment Services here in Massachusetts. I oversee the largest employment and training employment program. We have about 31 providers over our 22 local offices. So we don't really operate here in Massachusetts as a district. I'm a state level administrator, so it's actually for the entire state. We contract with employment and training providers to provide supports and services to our TANF recipients. And so that's kind of what I do. Part of what I do, I should say. The other side of it is I lead a lot of the work around engagement and employment within our TANF program. So here we work very closely. There's an awesome team of us that work really closely together. So I work closely with with our director of our economic assistance programs as well. And so we work pretty collaboratively to make sure that we're aligning in whatever that we do to really service our TANF families. And so that's a little bit about me. And I'm going to just start by saying, from the beginning of the presentation all the way to the end, all I could think about, and I was like texting a colleague and I said, the research is saying that everything we're doing is right. Right. And so what we've done here in Massachusetts, like my leveraging of these findings is that we just started talking to people. Right. We asked our staff to move away from, over assessing and, saying we need you to do this, or, when the pandemic ends, you're going to have to be working. We really were like, can we just ask people how they're doing? And so we really looked at how do you build a relationship with someone? How do we meet people where they're at? How do we trust and believe and honor that they know what they want for their families? And then how do we give grace with accountability? And so that is what we did. And so all of the researching and all the findings say exactly that. And we asked all of our programs to do the same. Right. And part of that, which we don't talk a lot about, is we did that for our staff. So we can't have an expectation for them to deliver a service and a support that we're not giving to them. So we started talking to our staff and we said, how are you? How are things going for you? Right. This is our new normal. So everyone's like, oh, when the pandemic is over, even when it's over, we cannot go back to what was. Right. We have to really leverage that. Case management and support matters, right? And I think, COVID has really taught us the importance of moving away from processes and really focusing on people. And it leveled the playing field as that we were all experiencing the same thing. So it was no more us and them, it was just us. And I think that's the biggest takeaway I had from all of the findings.
Thank you, Tyrese. I think you tied those two papers together so nicely, and thinking about the findings around case management in particular, and, even thinking about that support that, extended to project teams and really rethinking how we do that, as that came out in Katie's paper. So I appreciate those reflections. Just focusing on the recession and recovery paper for a bit, just want to dig a little bit more into the findings there. So Dana talked us through this, thinking about the different types of interventions that were most effective during different periods. And, we just talked about case management really having the largest effect during recessions, but education and training interventions having the largest effects during other periods, and really only one type of intervention being effective across all three periods, employment retention services, even though the effects were smaller there. So just taking all of that together, do you think there are any lessons that directors can start to take from the prior literature? Are there ways that administrators can be thinking about small tweaks to make to their practices to align? I mean, I know you talked about the way that things really were aligned with what you were doing, but I'm just curious if there are other thoughts, really thinking about the other findings more broadly.
So, I would say the smallest thing you can do is streamline what you can, right? Streamline what you can. There were a lot of, we cannot do this, right? Here in Massachusetts, our TANF application was not online. You can't do that, you can't do it. It was done, right? And then where do we go from there? So it's like the very small things. For us, we said, what were the things? Let's take this opportunity and get rid of and not bring back the things that were not flexible and didn't really work for families. And so one of the biggest things that we've done is we are not bringing back assessment. Right? We're actually moving towards, we're actually going to be rolling out a 1-page stepping stones that really involved the client voice throughout our entire process. And so the smallest change you can do as an administrator is to include the client voice on all levels. So that's in the policy through implementation. And I say that's probably one of the smallest things that we did, and it's been pretty easy and they have been amazing. Right? Like there's a level of knowledge that we get from the people we work with. And I say people we work with, and that's including our clients, not just our colleagues, like people. And that has been the smallest change for us, right? So it's a small change that's turning into a bigger change in the way that we're going to talk to people. And what we heard is that this is like you guys just talking to us. You're just going to be talking to us versus, unpacking trauma, right? And so that would be one of my suggestions. I think my other suggestion was just recognizing that there's no one size fits all and allowing some flexibility. One of the opening speakers talked about the flexibility that we have in TANF. And so it's really thinking creatively around how do we tap into what is flexible, right? So our assessment was flexible for us here. So we tapped into that. The way that we talk to families, we could tap into that, right? We reframed. We're like, here are the core elements of outreach and engagement. These 5 simple things, right? And we moved from there and we've continued to talk about it.
That's great. And I think you've given us some insight for this next question here, but we're thinking about the interviews that Katie talked about as part of that brief on remote services. And I'm just curious, I mean, you've talked about really the emphasis on people and the focus on staff needs in addition, but are there other lessons that resonated with you and your colleagues about adaptations, like either to service delivery or other things that we're internally facing that you all kind of saw as important?
So I would say we saw a number of things, right? We saw a number of things. One is that, access is important, right? Access, right? We thought, you get them, if we can get families laptops or or iPads or something similar, they're going to be able to tap into the resources. And that wasn't the solution, right? And then there was how do we provide these additional supports? And we had to provide those supports to our staff as well. And so I think those were the pieces where we're learning, right? Some folks like Teams, some folks like Zoom, some folks like WebEx, and it was those adaptations that we had to make. And so you're thinking about what we had to do versus what our families had to do. And then we had to think about what have we over-engineered within our system? And so that's really something we have unpacked, we've over-engineered. And then the other thing is what does the client experience look like on the TANF side, right? We should be talking to families about opportunities, not exemptions, right? And so we're really saying engagement starts at application. And, how do we do that? And so what we're doing now, we're preparing to roll out training our TANF workforce around what does that look like? And what does that handoff look like to an employment worker, right? Here we have full engagement workers and they handle a lot of the employment services part of TANF case management. But we want everyone to be involved in the process, not, oh, that's your job and this is our job. And so those are some of the internal things. And the other thing that a big shift that I'm pretty proud of is that we, our staff, our clients were responsible for reporting, being in charge of like reporting their participation and tracking. We have contracted providers. We contract with them. The responsibility will be on our staff and the contract providers. Like, why can't we just do that? And so we're removing things from the families who are already dealing with a number of things. And so we can remove one piece of something. That's what we've done. And so it's those little, they're small but big. And we've also talked about, like, let's talk to families about what's available, right? As a TANF recipient, you are eligible for these support services and these opportunities. So why not tap in? But then also respecting, if they say they're not ready, that they know that they can tap back in when they are.
That's really helpful. Yeah. And I'll transition us over to this last question. I mean, I think a lot of what you've talked about, Tyrese, is thinking about, where there's increased flexibility in service delivery and really capitalizing on that. And I'm just curious, are there important barriers that we need to think about that you continue in the way of like this increased flexibility? Are there any things to like keep on our radar?
So, of course, everyone's going to say childcare and transportation, right?
Yeah.
Those things are still really high up there. We fail to realize that our childcare workers are underpaid, and they are working with our children in their formative years, right? Like, as their brain develops, these are the people who are working with them, but we're not paying them enough. We're not paying them a sustainable wage, right? And so that interferes with access. And we know that if families don't have reliable childcare, then they're not able to fully engage or to show up in a program. And, when I think about transportation, I think of flexibility, because for us, many of our families who lived in transportation deserts, remote services has allowed them to engage in services that they were not able to before. And so for us, for me, what I've encouraged is for my providers to continue to provide those kind of services. And we've allowed flexibility for them to work in areas that they typically haven't worked in, to make sure that our clients have access, right? And I think having different modes of communication with clients is very important, right? And that it's based on their need. And so for us, we used to have like an in-person TFD, an in-person TANF orientation that kind of orientated you to the employment services side of the TANF world and what opportunities. And it was only in person. Now we're telling our staff, you do it in whatever works for the family. So if it's a group session, it's group. If it's one-on-one, telephonic, if it's virtual, if it ends up being on FaceTime, whatever, right? Let's do it in that way. And so I think those are like the high barriers, right? And then the other barrier is just bureaucratic systems, right? And processes that we don't necessarily need.
That is really helpful. And I like how, you talked about just how the increased flexibility can help with some of those important barriers that come up, like being able to reach a broader set of clients that we're dealing with the transportation challenges. And that's really helpful.
Or even like language, right? Right now, you can have a worker. If you don't have a worker in your office that speaks a particular language, you can connect them with someone else who does. And you can get on, if the client has access, you can get on a Zoom call, or you can get on WebEx or Teams, and it can be live and in person, right? And so you can see the interaction, but you can also be a support. And so I just think we cannot go back, right? Like, we cannot go back to what it was. We have to continue being flexible.
That's helpful. And again, I really appreciate hearing about this common theme of support, and just thinking about the recession and recovery paper and the findings for case management. I think that just ties in so naturally to what you and your team have been doing in Massachusetts. And so that is really just helpful to see.
Yeah, one thing I'll add too is that, in the report it talked about on-the-job training and learning. We realized that we have here an internship program that we call DTA Works. And what's unique about our program is that it's case management on two different levels, right? So you have case management within within the placement, but then case management within the program, right? So we have DTA Works coordinators who do one-on-one case management. We have financial coaching that's specifically for those in a cohort model. So it's like a supportive team, right? And so when life happens, because we know it will, we have put in the supports to be able to support those families in that. And I think that's what's critical about case management, right? Because there's case management and then there's real case management. And what we're talking about is like real case management that involves co-case management with your other partners. Hey, did you notice Diana was a little down the last time I talked to her? It's those little things, right? Or being able just to call someone and say, hey, this didn't make sense to me. Have you experienced this before? And to know you have that's been critical. And also for those on-the-job work experiences, actually being connected to a real employer, right? Like, of course, like I oversee employment programs. So I'm like, what's important and what research says works is when you have a real career pathway program that includes all of these things, right? And so how do we get there? So for us, we've created different tracks in our DTA Works program, and now clients have the option. It used to be strictly like administrative kind of work, and now they've gotten to work in communications and policy development, working with like the director of communications here, working with our policy analyst who does employment and engagement. Like that's the difference. And so it's actually something that the client is interested in and that motivates them. And we know if you're motivated, you're more likely to complete something.
Definitely. I really appreciate the rich examples you've shared, Tyrese. That's been really helpful. So I think I'll just transition to start to close us out. We just wanted to provide you with some additional information on the ways that you can stay connected with the Pathways Clearinghouse. You can follow us on at Mathematica Now or at OPRE_ACF on social media for the latest updates. And you can look for the hashtag Pathways to Work. You can join the email list, and Katie gave an example and showed you how to do that. And also certainly visit the website. The brief that Katie talked about is out now, and the Recessions and Recovery paper will be available soon. And with that, I'll just leave you with contact information for the Pathways to Work Clearinghouse and each of our speakers. And feel free to reach out to them with any follow-up questions you may have.